For those of you who don't know me, my name's Emma Boswell. I'm the Director for Partnerships and Engagement and a Place Convener for North East Hampshire and Farnham Place in NHS Frimley. And I'm joined by two colleagues here. I'm joined by Nick, who's helping us to coordinate the slides, and I'm joined by Kane. Kane, would you just like to introduce yourself and say hello?
Hi, good afternoon, everybody. Kane Thomas. I am the Interim Programme Director for the new hospital programme.
Lovely, thank you very much. And thank you. And on our first slide here, we would normally have Carol with us, and she came with us in December last year. But we did commit when we came in December last year to come back to the committee and share the outcomes of the very early engagement work we've done with communities and with staff on what matters to them in how we select the site criteria for the new site for the state-of-the-art Frimley Park Hospital. If we could move to the next slide, please. There we go, I shall do that. So this afternoon, the plan is just to run through some slides with you all to share the outcomes of the early engagement that we undertook. This engagement took place between November the 24th and the 7th of January. And then at the end of the presentation, Kane and I are very happy to take any questions, thoughts and reflections. So first of all, we just wanted to talk a little bit about what did we do during this engagement period. And we had a really in-depth programme to promote the opportunities for engaging with the site selection criteria throughout November and through to January. We had a number of different ways that we shared the opportunities to engage with us. So that might have been through local MPs, through their own newsletters and their own social media. We used our existing NHS systems of communications, our websites, our newsletters, our social media. We used partners such as Healthwatch and the Borough and Parish Council newsletters, and we posted information around key sites with posters as well, so health sites and others. So we had a really broad way of allowing people the opportunities to engage with us during this early period of time. The engagement was focused on what's important to people in the new site and what people thought about the criteria that we had developed to assess potential sites for the new hospital. And we really wanted to talk to people about, had we captured the right things? Was anything missing? Did any of those criteria need refining? And we engaged really on the three main areas of the criteria for the site selection. So that was around the actual site location, that was around planning and restrictions criteria, and around the purchasing the site criteria. And you can see on this slide here the areas that we look to explore with local communities. So we did a number of different things. We ran an online survey. We had 3,400 responses to the online survey. We ran 5 public listening events. 2 of those were in person, 2 were online, and 1 was a drop-in session. We had 8 community engagement events, which included pop-ups in local shopping centres, in health sites, in local libraries across Berkshire, Surrey and Hampshire. And the Trust itself ran 2 all-staff events, but also had a number of other ways of engaging with the staff within the Trust as well. In terms of the survey respondents and the demographics, we've obviously shared with you the in-depth report on the outcomes of the engagement activity. And in terms of where the respondents came from, 39% were from North East Hampshire Farnham, 31% were from Surrey Heath, 19% from Bracknell and 3% from the Royal Borough of Windsor and Maidenhead. And we were really pleased because these align to the patient flows into the Trust. So that felt like a really positive set of engagement flows. We had a good split of age. 48% were over 55 and 52% of the respondents were under 55. And 15% of the respondents considered themselves to have a disability. However, we did not succeed in reaching a really broad range of diverse communities. 94% of our respondents identified themselves as white. So we really want to learn from this and continue to build the ways that we engage with our diverse communities. We did use some of our existing networks, but we're looking to build further one-to-one relationships with faith leaders, with local community groups, with charity sectors, and thinking really hard about how we create better, more in-depth opportunities to be inclusive with the communities in this piece of work. a lot of this detail is in the report, so really we just wanted to highlight some key findings from the survey. And you can see some of these here, and I won't talk through them all. But in terms of location, some of the key findings about what was important was around access by car, distance from the current site, public transport, and key highways and key highway access as well. In relation to planning, what was really important was around the expansion potential of the site, thinking about the ageing population and the growing population locally as well, and noise pollution, infrastructure and sustainability really mattered to people. In terms of purchasing the site, everybody thought everything was very important, but in particular the availability of the land and the readiness and the appetite to sell that land for use as well. So a bit of a whistle-stop tour really through our public engagement activity at this early stage. We did share the outputs from all the work with a local organisation who did an independent report for us, which is what you see in the papers that you had. This is now being reviewed by the new hospital programme team, and that's one of the reasons Kane is here to join me today, really looking to think about how would we use that feedback to influence and shape further the site selection criteria as we step through the project. We are committed to ensuring we provide feedback to our communities, to yourselves, to our partners, on how we've used this information and engagement to guide the steps of our work. So I'm just going to pause there and move on, and we can take the slides down, Nick, if that's okay, and we could move to questions.
Thanks very much. And I think the first set of questions, Councillor Edward Hawkins is going to pick up on the external engagement and the issues around it.
Thank you, Chairman. Thank you for that presentation. Very impressive in terms of numbers and what have you. But at the end of the day, the respondents were 3,400 online responded. That's the residents' respondees. Do you feel that you did enough, bearing in mind the your customer base is something like 500,000, and bearing in mind that my division of Hillside Parkside is 10,000 people, and here you've got 3,400. I won't go into too much detail, but I was never contacted by you, as nobody sort of spoke to me and nobody sent me any information or anything like that. So I do just ask, do you feel you've done enough to date? Thank you. So far, I'll come back on other questions.
Yeah, I'll point out that Councillor Hawkins' division is right next to the hospital as well.
Okay, lovely. Thank you very much. And thank you for the question. And no, we never can do enough when we're looking to engage with our communities. And this is really at the very beginning of our journey, and there are lots of lessons for us to learn from this. And we always want to do more. We rely on our partners in terms of sharing information, as well as using all of our own networks as well. So apologies that didn't get to you, and I'd be really interested in having a conversation with you outside of the committee in terms of where and how we could best engage with yourselves and people within your communities. So no, not enough, much more to do, plans and learning in place to do it better. So thank you.
Yeah, thanks for that. It's so Trevor, one. Yeah, yeah. It's also, yes. It's not just your customer base, and I won't at this point in time complain bitterly about the problems that my residents have in getting past the Frimley Park roundabout, and the unhappy hours spent in queues getting past there because of the car internal layout of the car parking. But also, I mean, it's the whole concept. I hear what you say, but I mean, we've really got to do more, I would suggest, to make residents feel that their views are interested, their views are important. And the same is true for your staff. Because you've only got, was it 25%, a quarter of your staff, 25%. I would have thought on something like that, you have a captive audience. And it really, if any other organisation, I mean, you're slightly unfortunate that I actually have a master's in marketing. So, yeah, precisely. So I've been
Very
through the mill
useful.
on all of that, and a 25% response from a captive audience is, shall I say, meagre. I mean, what are you going to do further? It's all right saying you're going back to other people, but, I mean, there's your audience, captive audience. What are you doing to engage further with them, for instance?
Thank you. If I respond first, and then I could hand over to Kane, who works within the hospital trust site. So there were a number of different ways that we engaged with staff and the trust engaged with their staff. One of the ways was through the online survey. There were 2 all-staff events. I think over 600 members of staff attended those. I know that the new hospital programme team went out and engaged through existing meetings within the trust and engaged with staff in different ways. So there are a number of different ways that people were engaged. You're absolutely right in terms of the size of the workforce of the trust and the numbers of people engaged. And we keep this engagement activity going on. It's a journey. There are lots of things we continue to do. We've got a really deep engagement plan up, which I think was shared in some detail with the papers back in December. Obviously, we're going to go back to that and refresh that in light of the outcomes of the early engagement that we've done so far. But I'll pause and I'll just see if Kane wants to come in and respond, particularly around engaging with the trust staff.
Surveys were undertaken, Emma, and that feedback is playing back into our selection criteria, so that the criteria that we apply when we're looking at sites is taking cognizance of that feedback.
Thank you, Kane.
Well, I'm going to play devil's advocate here. Yeah, I hear everything about you say, and I'm going to slightly off-piste here, Chairman, but at the end of the day, what is the deciding factor? When you look at the list of comments made by various respondees, at the end of the day, the ultimate decider is location. It's where you're going to put the hospital. Does it stay where it is? Is it going to another location? How is it accessed? These are the issues that really matter to people. And you can garner as many comments as you'd like, but you have to build those into a new design. But really, it's the availability of sites within your area. Lower Farnham, or whether it's up at Ascot. It was a very nice facility in Ascot, and I will declare I had some great treatment there. Or whether it's moving further into Buckinghamshire. You know, it's where you're putting, it's the availability of sites. But I still feel that the exercise carried out was, in the nicest possible way, limited. I'll stand down from that, because otherwise people get bored with me, and I know Rissat wants to make a question.
Yeah,
Thank you.
Councillor Khan.
Thank you. I just want to touch up on how you're dealing with, how are the BME communities with the cultural language barriers being addressed in understanding the process that's taking place. And also, I was trying to look for the questions and the consultation that was done on the questions that you asked everybody, and I couldn't find anything in the pack. Well, I couldn't find anything in the pack. Could you elaborate on that? What the questions were with the consultation?
Thank you for the questions, particularly around how do we engage inclusively with all sectors of our communities, and is something that we are absolutely committed to, as driving health and reducing health inequalities is core to our whole system ambition. We have some really great examples of some of the work we do, working with local community groups, working with faith leaders, working with the voluntary sector, working with our interpretation services to ensure that those communities can engage in our work, and that hasn't come through in these results. So we will continue to go back and work with all of those groups and ensure we build on some of the elements of best practice that we have elsewhere. The questions specifically, I'm just trying to recall, I think they were shared in the paper back in December, but I can't remember off the top of my head, so I'd need to come back to you on that one, unless my colleague Kane can give any further information.
There's nothing I've had to add to that point, Emma.
Councillor David Hum.
Thank you, Chairman. I'm also on the question of who was consulted. I represent an extremely rural area, quite a large one, and the result is that it's very difficult, and I'm not disputing the fact that for you it's very difficult to know which is their hospital. They have enough trouble they do as individuals, they work it out, but it really depends on which surgery they're using and where that surgery happens to be affiliated to. And so some of them are affiliated to the north and some to the northwest, northeast, and so they're scattered about. So I make no apologies for the fact that's the case. It's just that the result is that people don't know at all what is going on. They accept my word for it, having been on one of your visits, to understand exactly why Frimley Park can't go on as it is. And it needs to be a new start. But then they say, but where's it going to go and who's going to decide? So that's a big issue for the rural communities, which incidentally, on the subject of diversity, includes the world headquarters of one particular sect, who definitely look towards Frimley Park as being their hospital, because I asked them. And they've got a whole heap of people there who, quite a lot of whom have children. And so they don't have linguistic difficulties particularly, but what they do have is a certain amount of difficulty in understanding how things fit together, if I could put it like that, and they like to be involved in consultation.
Thank you. And you're absolutely right. It's imperative that we ensure we offer a really broad range of opportunities to engage in all of our work, particularly recognising the different needs of our communities. So being able to come out into communities themselves, do face-to-face sessions, to offer online access to virtual sessions, surveys, etc., really matters. Making sure that we work harder. And one of the things I think we said when we came in December was about how do we use our really strong partnerships and our networks, such as yourselves and all of our other partners across the system, to make sure that we are getting out and reaching into those communities. So certainly we would really value working together on that through the next stages of the programme and in our engagement, and making sure we're using all the intelligence and the insights that together we have together with our local communities to make sure this is really strong and broad.
Thank you. And the next set of questions is Councillor Ernest Mallet.
Thank you. Good morning. I have some serious problems or questions to do with your previous presentation, but to do, first of all, with this present situation, which is concerned with consulting the public. Two things I noticed, particularly about your approach, is the two things are on land and bus. First of all, I'll take the bus. There's almost nothing in your survey in terms of giving any importance to bus transport. I mean, you know, in this day and age, first of all, ecologically, we don't want people running around in cars if we can help it. But more than that, if you have a look at any other hospital, you'll find that they're running out of space, so they're building on their car park. They have virtually no car parks anyway. So you must really give a more emphasis on the fact that your major transport to your hospital for the public will be by bus. And there's nothing in this survey that seems to lead to that. And the other very odd thing in the survey is that, and this is not your fault, of course, but I hope you're not going to take any notice of it, there's only 1% of the people in your survey who say that the fact that you'll find a site that's up for sale is important. I mean, if you haven't got, if you can't find a site, if the person who owns the site is unwilling to sell it, you haven't got a site, not even to negotiate on. Yet you've got 1% people, 1% of your people who came back to you have sort of said, well, that's not important at all. Well, you know, how stupid is that? It really disturbs me. I mean, my opinion actually is that you do better to abandon the survey and take a trip down to the Queen Alexandra Hospital north of Portsmouth, who've got a massive situation there, and they've got a bus station in the middle of the hospital complex, bigger than any town has got, and that's how they're dealing with it, quite apart from the fact that you get a very good idea of what sort of buildings you need, how many blocks of flats you'll need to put on the building, on the site anyway for your staff, and all the other things. I mean, they've really got it sorted. You don't really need to do a survey. If you want to know what you should be doing, you need to have a look at the latest type of hospitals that have been built, and you'll get a much better idea, because I don't really believe that the public has got the ability to actually direct things. If you're going to take notice of your survey, I think you'll be going in the wrong direction. Anyway, that's my point on your survey. If you want me to give you some questions on the way you're going about it, I've got a list from last time.
Shall I just respond on engagement, and perhaps Kane can come in sort of on green travel and car parking and hospital design, etc. That might be helpful. So thank you, and it's really important that we do engage with our local community to ensure that the things that we think are important, and that we haven't missed anything that matters to people, that as seeing things through our lens we might have missed. And you're absolutely right around some of those responses. If land's not available to be bought, it's not available to be bought. But we did get some useful information about what people think is really mattering, and you talked about them yourselves: public transport and car parking, etc. So, you know, being able to use some of these insights and help them to guide our work is important, and some of them, as you say, will not be relevant because of the systems and processes which we need to undertake. But I'll hand over to Kane, particularly on some of your comments around parking, design and transport.
Thank you, Emma. Thank you, committee. So on the point,
can I just query your general approach, if you don't mind, or well, you probably will mind, actually. But last time you came, which was a short time ago, you were telling us you were going to put the first brick down in about 15 months' time, which seemed impossible to me. You had no site, you had no design, you had no architect, you had no planning permission, you had no contractor. In fact, you were right at the beginning, which you still are, where you are now. And yet you were talking about putting the first brick down in about 15 months' time and building the hospital in over a 3-year period from there. I mean, totally unrealistic, really. So, you know, have you got a proper kind of program for going through these various stages that you're going to need to do before you can even think of putting a brick down?
Kane, do you want to cover that one as well?
Sure, yes. We've made significant progress in the last few weeks and months, working towards from a long list of possible sites, applying a hurdle criteria on the viability and non-viability of certain sites as we move towards from priority sites to preferred sites, and the level of due diligence that we're applying to those sites. So we have made significant progress, particularly in relation to the transport assessments that we've done in terms of the transport modelling to the existing hospital to understand where our patients, visitors travel from and the travel distances to the existing hospital. And we've applied those metrics to the sites that we're looking at. We've understood the public transport network on the sites that we're looking at and what we need to do to improve that, to replicate and improve the transport, public transport facilities on the sites that we're looking at. So I would suggest that there significant work has taken place and is continuing to do that as we move towards a preferred site. We're not there yet, but we've done significant amount of work on that, on the due diligence. In terms of the program, no one's denying this is a challenging program, but we're working with subject matter experts, consultants, and we're working with the national program as well, the new hospital program, and the experts they have in terms of programming and planning advice. And at this moment in time, we have assurances, and we've programmed it out as a significantly detailed piece of work to understand the program and how with modern methods of construction and technology that are available, we can deliver the project in 2030. And we're confident we have that level of assurance that that is still achievable. Yes, we have a detailed risk register. We have mitigation plans in terms of risks of the challenges that we'll encounter along the way, no doubt. But we have that program, we have that level of assurance in terms of deliverability at this point in time.
Thank you.
Emma, sorry.
Yeah, I'm going to come in here as well. Really to ask you about what consideration have you given to how the NHS is transforming and how medicine generally is changing? And the reason I'm asking that is because back in 1974, when the first tours of Frimley Park happened, I've still got the tour guide. By 1976, there were newspaper articles out about the hospital being too small and the design and use of rack actually limiting it to the 2 stories, and so it was incapable of expansion, incapable of taking on new services. So one of the things I view as really important on this, the shape of services are changing. The requirements on hospitals, in some respects, are unknown at the moment because they are going to change and develop. What are we doing to make sure that we future-proof this?
So I'm happy to start off on that, and then Kane, please do come in with anything that I missed. And you're absolutely right. This is a really unique opportunity to transform our health and care services for our local communities. And we can only do that by working together with our partners, and in particular that whole systems approach, thinking about some of the direction of travel around modern services, care closer to home, thinking about using technology and digital solutions to improve care and services, and also to learn from those not too distant lessons already. If you think sort of in the 70s to where we are now, and the rapid change in the design of services and technology and the way we work, such as virtual wards or the targeted lung health checks we can now deliver from car parks, it's really quite phenomenal. So being able to keep agile, being able to have a site that has potential expansion potential, which came clear through that staff and community engagement, engaging, as Ken was saying, with subject matter experts, people who have got their eye on the ball for the future, and really thinking about how we design that clinical service model together with our clinicians, with the people at the forefront of the work and their professional work that they do, is everything we need to keep in mind. And it is again going to be a challenge when you're trying to design something that's so forward looking, but that's part of the programme of work, and that's really why it's so exciting. Kane, is there anything I've missed you'd like to add?
This is a once in a lifetime opportunity to improve the healthcare facility provision in the locality for another 50 years. I mean, Frimley Park has been in existence for 50 years. The new hospital, when we start designing in detail, will be designed for that same type of duration. And it has to have the ability to flex, expand, and those considerations are being taken into account. So it has suitable future provision to do that, and to do that sensitively and in aligned with developing clinical strategy and the considerations of the locality and the local population as well.
Yeah, thank you, Chairman.
Thank you for that. And Edward, over to you.
Yeah, thank you. I mean, Trevor has a very good point there about the future shape of care, both in the hospital and, I mean, the discussions we had earlier today about taking it more out into the community with greater element of community care. But with the best will in the world, yeah, okay, I actually, it's just slightly not flippant here, but just pointing out, you mentioned communication with your staff. At 25%, I think you've got to step that up, but that's by the by. Let's say that the best will in the world, a new hospital is not going to be ready for another 5 years. I understand the construction process. You haven't got the site. the site infrastructure is going to be horrendous if you're going where I think you may well be going. It's a challenge. So in the meantime, we've got 5 years or more of chaos, congestion, frustration at Frimley Park. I know you put a planning application in for 92, 95 staff car spaces with the demolition of some buildings at the back of the hospital, and you're building 2 diagnostic buildings. So you're viewing that there will be an ongoing extant demand for the services at Frimley Park. What are your plans? I mean, the bus service is patchy. Some of the small buses, some of the big buses, they've got to turn in from a very tight turning where the old Sea Cadets were. You may not know that. I happen, because I'm slightly old, long in the tooth. But it's a tight turn. And it's impossible to get the traffic flow through there. Some days cars are parked up on the green, they're on the car park because people cannot get to their appointments. More often than not, my postbag is full of people complaining they cannot get to the hospital. What are you going to do for all the residents in the area to make things better for them in the interim period? Thank you.
Kane, this is something probably need to bring you in on in terms of what's the planning aid to maintain the safety of the site through the duration of the build and mitigating the risks that RAC have, alongside the work that we can do, which is limited. And I think we should be honest and open about the frustrations and the challenges as a local resident and someone who uses the services of Frimley Park Hospital itself. I can definitely identify with those challenges for myself and my family as well, and recognising the challenges to what we can do and how we can make things more effective. But the comment for me would be about and how we keep working together with our partners across the broader system to ensure that only those people that need to go to the site go to the site, that we can provide care and services from other locations using modern technology in a different way, which might help to ease slightly some of the congestion, but we have going to have a log jam and an issue for the short period of time. Ken, you might be able to provide some more detail.
What we're looking at opportunities to phase the delivery of the new hospital in terms of sequentially moving out services as and when the new facility would be ready. They're options that we're looking at, and that would ease the kind of the congestion. Obviously, that isn't at the front end. That would be towards the end of the project. But those are plans that we're looking at and seeing how we can phase the handover and sequentially occupy a new facility to gradually ease the burden on the existing site. Just dropping onto the infrastructure point about horrendous infrastructure upgrades. No infrastructure upgrades are easy to facilitate and deliver and cause all of us disruption about our daily kind of life in terms of going about from day to day. But we'll look at that as sensitively as we can to deliver those, working with the local authority and all of our key stakeholders to make sure that the necessary infrastructure upgrades to make sure that the new hospital is accessible and is significantly an improvement on the existing are available and can be delivered.
Councillor David Harmer.
I just wanted to ask you, having visited the site with you and then having consulted one or two technical authorities, are you still comfortable that Frimley Park will last another 5 years?
Kane, shall I hand that one over to you? Certainly, when I'm happy to. When we came in December, and we came with Kish, the Chief Finance Officer, we were talking about the risk mitigation plans that have put in place to ensure the safety of the site as it currently exists through to 2030, and the work that's been done to ensure that this site is safe until we have a new trust and new building open. Ken, I don't know if you've got any more information on the kind of that programme of work at all.
we're continually working with our subject matter experts and consultants to make sure that the safety of the building, and specifically the rack, is monitored. There is a process to continually monitor the rack, not just with specialist advisors, but also the HSE as well, in terms of site visits and monitoring and reporting on that. So we will continually implement the process to make sure that the existing hospital is safe and can function correctly, and operational continuity is maintained without placing a greater level of safety upon any patients, visitors or staff.
Thank you.
I'm going to ask some questions around the sustainability, net zero and biodiversity, because a major hospital, by definition, is an environmental monster. With huge emissions, huge stream of waste coming out of it, huge electricity consumption, huge sewage output, large water requirements, etc., etc. Added on to that are the modern trend to net zero, the large number of vehicles that come in and out of the site. You're going to have staff there who are going to want to be able to charge their cars, frankly, because with the hours they work, that's likely to be one of the things that they're going to want to do whilst they're parked, which is going to add to your electricity requirements no end. So yeah, I'm concerned about how you're actually going to manage that huge environmental impact and still meet the planning requirement that's there now, that you show a net biodiversity gain of at least 10% on the model that's been developed for that. So again, a difficult thing to achieve on a hospital site, and with the sort of level of impact that you've got, it's going to be huge. So difficult things to address in a programme. So I'd like some views on that, please.
Difficult things to address in a program, and difficult things to address in a question that completely covers all of that, but I will try my best. We have some of the best designers that the UK construction and property development sector has. Some of the experience spans decades of healthcare development, and some of the most modern and new technologies that are being applied, aligned to the new hospital program ambitions. To the new hospitals that are delivered under that program will be some of the most sustainable and environmentally friendly hospitals that in Europe, quite frankly. The BREEAM accreditation will be excellent. These hospitals, the ambition and the objectives that they are net zero. Will be all electric hospitals. Those are the criteria that the new hospital program has set. Those are the criteria that we will be implementing with our design criteria. Of course, we'll be working with the local planning authority on that net zero carbon and the biodiversity net gain agendas to make sure that we are fully compliant and above and beyond the baseline of compliant as well.
I'll sound one note of caution there, which is going back into history. Frimley Park, when it was built, was a model hospital, one of a series that the NHS was building, using the best techniques of the time, and touted as the most advanced and all the rest of it, and then they put rack throughout the building. Do be careful, I would say, with anybody that says new technology, that you basically take them and nail them to a wall, and interrogate them very thoroughly, because it's something to worry about, frankly.
I absolutely take the point. I mean, 50 years of technology advancement since the existing hospital. allow us to have a better understanding of construction and technology far more than we ever did 50 years ago. This is a program containing a number of new hospitals that are being developed in an approach that allows them to embrace that technology and to deliver these new hospitals.
Councillor Mallet.
To try and be helpful to you, I take it that you do realise that there isn't land in Surrey to just pick up like apples on a tree. So I take it that your policy has to be to look for a greenbelt site, which you're allowed to build on being a hospital. And then, of course, you can cash in on your present site by selling that perhaps for housing or whatever. So I take it that that has got to be your policy in terms of finding a site. Am I correct?
We have a selection criteria for finding a site based on viability of the site, based on a number of considerations in terms of what a new hospital would look like in a certain area on a certain piece of land. All of those are being considered under a number of headings, whether they be ecological, transportation, flood risks, geo-environmental, utilities, all of that selection criteria. And that's just an example, and that's not all of them, that is an exhaustive list. That's just an example of the areas that we are looking at in terms of the level of due diligence that we're applying to each of the sites we look at is significant.
Another question, can I ask you, have you actually engaged an architect for this project at the moment?
We have a team of professional advisors looking at the level of due diligence for the phase that we're at.
Is the answer no, you don't have an architect?
We have an architect as part of a professional team of advisors who are helping us develop the feasibility and viability of the stage and the process that we're at.
I mean, frankly, you know, I'm not a builder or a developer, but my whole conception of what you're trying to do is you do need, at this stage, a first-class planning agent and a first-class architectural company at least, and possibly a contractor who you already sort of got your eyes on to discuss these things. Otherwise, you're talking about 2030 and you'll never get there. You seem to be not actually engaging the office, the kind of corporate bodies and other people you need to engage. And that comes back to my view that, okay, you can do what consultation with the public you like, but at the end of the day, you've got a big technical problem on your hands and you need competent agencies to actually advise you and get you moving in the right direction. Otherwise, you've got the best of intentions, I'm sure of that, and you know you're doing your best. But unless you actually change somewhat your kind of way you're proceeding with this, you'll never get there. I won't be here by the time you've built it, but it could be well in the middle distance.
Councillor, as I said earlier, we have some of the best design consultants with their healthcare experience spanning decades, working on the programme, advising us on the due diligence that we're undertaking, whether that be designing and architectural services, whether that be transportation, whether that be mechanical and electrical and infrastructure. We have those services engaged on the programme, looking at the due diligence and the technical viability of the sites that we're looking at now. Under the new hospital programme, the new hospital programme, our partners are engaging with the market to look at the availability, the market pressures, the programming, and expert feedback from tier one contractors who have the capability and suitability to deliver this programme. So there's a lot to, I think there's a significant, what I say, that just to summarise that and finish it, there's a significant amount of work going on at a programme level and also at the national programme level as well.
Okay, Councillor Edward Hawkins again.
Thank you, Jim. That's actually a helpful answer, because we got a scale of the things. I mean, I understand these things. Who is overseeing? You've got various strands, you've got different disciplines, you've got different people doing different things, putting together. Who is overseeing all of this, and what's their skill base?
So we have a robust governance structure, which ultimately reports to the trust board. Below the trust board, that there is a program team. I'm the interim program manager. I report to a senior responsible officer, and that reports through a governance procedure within the trust, which then reports to external stakeholders, whether they be the national program, Department of Health and Social Care, up to Treasury. So there's a robust governance procedure in place, both at trust level to manage the program team. All of the consultants and design consultants I refer to have gone through a procurement process to assess their credibility and expertise. So that governance process is robust and being carried out at both trust level and beyond with strategic partners.
Yeah, can I suggest that we park this, and it will naturally come up in the JHOSC as one of the subjects to be picked up in the JHOSC, I think, because it's obvious that there are significant issues here that need to be properly explored, and it would be a case of documenting them and handling them through that route. I have also questions around consideration of health inequalities and deprivation issues. The disabled access to disabled parking and things like that, it's not good at Frimley, frankly. It puts the disabled in the same queue as everyone else trying to get into the car park. So even if there are spaces there, they're unable to access them very frequently. It's a major issue in terms of what it is, where it is, how you get to it. Similarly, there are issues for those with mental health problems. So it's something I think that really needs thinking about a lot, but also access of people on low incomes to the site, getting to and from can be a difficulty. Even a bus can turn out to be too expensive for some people, because if you are on universal credit and that's your sole source of income, it doesn't allow for even bus travel to the hospital. So we do need to think about this, because what we don't want is people phoning up for an ambulance just because they're on a low income. We do need to actually think about how we actually manage that. So I'm just going to raise that as an issue for yourselves.
Thank you. And as I said, reducing inequalities is absolutely core to our work. And as we all know, we require a whole system approach to ensuring that everything we do between us is supporting people who experience inequalities and outcomes, particularly in health, are addressed. They are core to the programme. We'll be continuing to embed them through all of our work. There's lots of lessons we can learn from the things that don't work well, as you've just pointed out, around disabled parking as it currently exists, and ensuring that we engage with those communities who have that lived experience in our programmes of work. So thank you for your reflection, and it's absolutely key to what we do.
I'm afraid Edward's got some more questions for you, I think, as well. Yeah, you do.
No, I do.
Yeah. You asked some about purchasing the site as well.
Well, I think we've...
Michaela had a question, which I will ask for about local businesses and the impact on the local businesses. Have we thought about that as well, please?
Kane, do you want to come in on this one?
That is, yes, it is part of our consideration, both on the impact of moving the hospital from the existing location, and also looking at that in the context of of a new site, and the impact there, and what we potentially need to do to support local communities and businesses. So yes, we are looking at that.
And I think, finally, the other question is the hospital at the moment has a hugely strong relationship with the armed forces. A lot of your staffing, are armed forces. And excellent nursing I've had from them as well. I question, what's the relationship going forward? How is that being looked at? And particularly in the light of the Army's decision that they are going to significantly increase what is happening in Pirbright, and that it will be the major entry training centre for the Army.
Thank you. And as you say, we have an excellent relationship with the armed forces locally, and is really embedded in our communities, isn't it, in our geographical places as well. And we continue to work, and the Trust continues to work really actively with the MOD and with the armed forces and others who share the current site, to think about what's the future opportunities for sharing sites, resources, capacity and resources. So again, something key to our programme of work, and is being actively worked on and considered, and using those really strong partnerships that we already have in place to make sure that we do that well.
Thank you. I think, my concern, centres around the staff that you're currently relying on. A large portion of them come from the armed services, but the other side of it is also, they're a major customer. And if, God forbid, we
Absolutely.
should end up in a war, there'll be a real major customer. And we do need to think about that in terms of location and capabilities. So, I want to make sure that is taken on board. Okay, we're going to move to the recommendations. Sally, if you'd like to put them up, please.
Hi there. So the recommendations for a new hospital for Frimley Park Hospital is to ensure that you continue to make your plans public and consider how you are going to continue to engage the community, to ensure that you continue to refer to the consultation process, which needs to be continuous throughout the development process, to review what has been done and monitor how you will follow up afterwards, to make sure that your services are maintained throughout the whole project, and to ensure that communication is out early and provides detail of the choice of the site and of the issues that you foresee.
Councillor Harmer?
Could I suggest that we have a little preamble sentence that says this is addressed to the team dealing with the development of the new hospital?
Yeah, that would be fine, I think.
I think something like that.
Yeah, if we can. And
sorry, Mr. Chair, sorry to interrupt. What I've been hearing has been telling me that the leadership of this project is somewhat opaque, and I would have expected some of these recommendations about, identifying where the leadership is and so on.
Can I jump in as well on that? That I would like to see a greater element of public consultation. It's keeping people aware, but the consultation has been shown to be less robust than it could be, shall I say, and there needs to be improving, continuing, ongoing. And I'd also like to see something from the hospital as how they're going to push water uphill and try and resolve the car parking, the car access system and the bus car access to the hospital and the buses. Again, that needs to be made public, because the people in the immediate area are suffering day in, day out, by and large.
Okay. If we could just, we'll take those ideas away, add them into it, if we can just agree the ideas are correct, rather than trying to sit here wordsmithing for the next Yeah.
What we need to understand is what the officer leadership is.
Yeah.
Yeah, that's what you meant, wasn't it?
Exactly what I meant.
Absolutely. And the governance of this and how it's being driven is
Yeah.
very key. And at the moment, it's very opaque. Okay.
And I'm being parochial.
Yeah, yeah. So with the additions of something on governance, something on car parking, and
Access.
Oh,
something on
Stanley's probably
access
already writing it down
and
now.
clarity of leadership,
Yeah,
are we agreed?
yeah.
Okay.
We should check the
Fine.
wording.
I can't hear Ernest, and he's agreeing.
We just need to check the wording, that's all. You know,
Yeah.
the wording's important.
We'll push the wording up. I think
Well
it'll
done,
be
well
okay.
done. Yeah.
The last item on here, or the last major item on here, is the establishment of a joint health overview and scrutiny committee.
Thank the participants first, Mr. Chair.
They're still here.
Sorry?
Thank the participants
Oh, they're still
first.
here.
Oh, yes. Well, I think they want to listen to this as well, actually, Ernie, so,
Yeah, they do. Yeah.
so
They say they do.
this is kind of important to them.
Yeah.
So this is establishment of a joint health overview and scrutiny committee for the continuing programme, with the terms of reference and have been shared already. They have to be consistent across all three authorities that are involved, so
It sounds, Chairman, I was going to say it looks like there are 4 now because there's a bit of Wokingham in there too.
well, the agreement is that it will, from a JHOS point of view, that it will be Hampshire, Surrey and Bracknell Forest as
Bracknell
the
Forest,
major
yeah.
participants.
Okay, that's fine.
Other local authorities are allowed to have observers, and any divisional member who's impacted is also allowed to come along. As I say, voting rights will be rationed out proportionately. So that's the basis of it. And are we agreed on the terms of reference being endorsed and referred to full council for approval? Okay. Next item up is the recommendations tracker and forward work plan. Yeah, we have actually finished. Thank you very much, Emma, for you and your team coming along, and
Thank you, and thank you for your time and reflections. They're all incredibly helpful, so thank you.
yeah.
Thank you. Bye-bye.
Right.
Take care. Bye-bye.